I'm going to do my best to answer your questions in real time, but this is going to be different than other workshops that we've done online, other webinars, because normally it'd be a lot more talking visual part, but this time there's a lot of content, there's a lot of detail, not too much detail, not like overwhelming, like too chim, right? However, going to be sufficient detail that needs some visuals, because can't really explain the visuals just by talking. So pay attention to the slides. And if there's an important part that I want to stress more about, that I want to really, that the slide cannot explain thoroughly or clearly, I'll cut away and I'll talk directly. So you know exactly, if I'm talking to, there's a definite important point that I need to make regarding a certain part of this talk, okay? So hopefully you can get your attention. If you're multitasking, I'm gonna try and capture your attention in the next 30 minutes, if not less than that. But I will do is to, once again, try my best to answer the questions in real time for you guys. So if you guys are ready to get started on our topic of inflammation, okay, here we go. Now, here's what's funny. If you look like this, or if at any moment in your life that you felt like this, you look in the mirror and this resembles you, this workshop is for you. In fact, if you're between the ages 30, 40, 50, or 30 and above, you slowly start to notice that this is what's developing across from you. Chances are you're developing some form of inflammation. Now, obesity is one sign of inflammation, or getting fat around the midsection is one type of inflammation. But I want to clarify that not all inflammation is bad, okay? We have some good inflammation and bad inflammation, okay? So there's two types. There's the type of inflammation that happens when you bruise yourself. You fall down, you get a bruise, you get a scar, it swells up, it's tender to the touch. And there's another type of inflammation that doesn't heal as prominently, right? So the acute inflammation, or the painful one, is when you have an injury, when you have a damage directly. You can see it, you can feel it, it stops you in your tracks, and you don't want to do anything else beyond that point. Then your skin changes color, then it gets red and it swells, it gets pussy. But then eventually over a couple of days or even a couple of weeks, it heals. Maybe a little bit of a scar, but it heals. All that is part of a natural response that your body's designed to do to recover and heal, repair tissue damage. But the one that we're talking about today is a silent one, the one that you don't see, that you don't feel. More importantly though, but you might notice it when you look in the mirror, such as that slide that I showed you before of that obese person. So chronic inflammation. Okay, this has been studied for the last 2 decades. It wasn't really understood much. In fact, it was even featured in Time magazine, one of the most respected news journals or articles out there, or magazines out there, and done research on how inflammation is tied to the most common diseases out there. So chronic inflammation attacks tissues at the cellular level. Okay, so it's not old news. But however, people need to be reminded about how it affects their current lifestyle and the current quality of life today. And that's what this workshop is all about. And once again, if there's any questions, I will try my best to answer. Okay, real time, open questions. Okay, got it. All right, so what does chronic low-grade inflammation look like? And just for the sake of this talk, we're going to use the acronym or the words CLG, chronic low-grade inflammation, meaning that you don't even notice it, you don't even see it. It's not always visible to the mirror, it's not always visible to other people, to even doctors. It can go misdiagnosed if a doctor's not looking for it or not asking the right questions, like either a TCM or a medical doctor. Okay, so what does it look like in your day-to-day life, day-to-day routines? So, looks like heart disease. If you're on cholesterol medication, chances are you have some low-grade inflammation. If you had a history of stroke, okay, or if you have heart disease, right, you have angina, these are all hallmarks of inflammation of the blood vessels, okay, of your vascular system, narrowing of the arteries in the brain, or narrowing of the arteries in the heart. Another form of inflammation comes in the form of how it alters your mood, because you're changing certain properties, certain ingredients, certain tissues, and it also changes the neurochemistry of the brain that creates depression, anxiety, that creates states of mental disorders that require mild medication or severe medications, severe depression. So this can be offset. Also, brain degeneration. Now, I know firsthand this is an increasing population of people getting older, especially in Southeast Asia, and Singaporeans live long. But if you're an older person, I bet you any money that any one of us on this call right now has a family member or relative that is living or suffering from Alzheimer's or dementia or some other cognitive decline. That cognitive decline can often be related to not just genetics, but often related to what's allowed into the body that creates chronic inflammation, right? That affects the brain. Very, very horrific lifestyle to live with as you get older. But here's hope. You can avoid it. We can help defer or decrease the likelihood of this being part of your future. Okay, obesity. Yes, it's not just an American problem. It's not just a Western problem. We see this now in Singapore. We see this now more chronically in Southeast Asia, specifically Singapore, because of how affluent we are, of how much resource we have, but more importantly, of how we feed our kids, how we feed our children. We're no longer eating from home. We're no longer cooking from scratch. So often the obesity, diabetes, cancer are also indicators of long-term inflammation that starts at a young age. Okay, so this picture that you see right now is disturbing because I see this every day on the train. I see this every day on kids going back and forth between school. You probably see this as well, but we probably did not see images like this many years ago. Okay, you did not see this 20, 30 years ago. Guys, gentlemen, did you see how many overweight recruits or how many overweight people did you see enlist into the army? Very much less. In fact, they had to change standards because of this. Okay, so obesity, diabetes, and cancer are hallmarks of CLG, chronic low-grade inflammation. Joint pain, swelling, arthritis. And we have a lot of people come through our doors because they have joint pain in their spine, in their neck, their shoulders, or if you're trying to be active, you notice in your joints, your knees or hips, more often in the knees, okay? And that excessive swelling, excessive chronic joint pain that happens when you're trying to exercise or just trying to keep moving shows up because of chronic low-grade inflammation, very gradual. Sometimes it's visible. Sometimes we can see it when you're lying on the table and it's painful to the touch. Now, this is something that's overlooked. If you know somebody, either yourself or a family member or a friend, and you see this on their face, or you see it on their skin, or see it on the knees. And what we see sometimes is this happens on kids as well. You see these markings on the legs or the back of the elbows or certain parts of the arm, and it frustrates parents to see blemishes and scars or anything discoloring the skin, right? A pale skin or a clear skin. So it's a topical way of treating it, which you can take medications, topical creams, either through traditional medicine or traditional Chinese medicine or Western medicine. But people are not asking the question, and most often doctors are not asking the question, what are you allowing into your diet? What are you allowing that creates low-grade inflammation? Okay, allergies, asthma, eczema, acne, these are all hallmark signs or indicators of low-grade inflammation. Now, poor recovery. Yeah, you're slow to heal, right? If you know somebody's under chiropractic care and they're getting adjusted and they say, wow, doc, I have an amazing results. I got so better so quickly. I can't believe I responded so quickly. And every so often we have some patient that say, you know, doc, that pain is still hanging out, man. Or that shoulder joint or that lower back issue, it's healing, but not as quickly as I expected. We can attribute that sometimes to inflammation, low-grade inflammation. Or if you have chronic asthma, right, or allergies, which is an over-exaggerated immune response, that's inflammation as well too. That's also a hallmark indication of low-grade inflammation. Now, what causes silent inflammation? Now, this is what sums up. We got to look as to what we're eating. There's a balance of fats, because not all fat is bad, okay? In our diets, we have omega-3s and omega-6s. I don't want to make this too complicated, but we got to focus on the balance, omega-3s and omega-6s, okay? In fact, just to go forward a bit, here's what it looks like. The image on the right that you see, omega-3s, you're looking at fish, you're looking at fish oils, nuts, you're looking at avocados, you're looking at walnuts, you're looking at soybeans, you're looking at salmon, Okay, you're looking at even shrimp there, or shellfish, grains. All those are sources of omega-3s. Okay, on the left, what you're seeing right now is often what you find in the hawker food stands. The oils that you see there is a cheap processed oils that is often cooked and used in hawker stands, traditional food and traditional fast food here in Singapore that I've seen. Okay, and the reason why this is important is because in our diets, if we're eating out, if we're eating quick meals, cheap meals, we're eating out instead of eating at home, 9 times out of 10, your meal, if you're eating traditional hawker meals, is being cooked with oils like this. Because get this, Asian food, amazing. Street food, amazing. Guess what? Singapore has the best street meals as well. But unfortunately, the lifestyle that we live by eating out and eating this type of quick, easy, cheap meals is full of the omega-6 fat that creates this imbalance. Okay. So nowadays, our modern diet is 10-to-1 ratio as opposed to 1-to-1. So let's go a bit more details to what that looks like. See, those essential fats, that omega-3 is important because every single cell in your body is surrounded by fat. The fat is like a barrier that allows good ingredients to get into your cell, the nutrients and of the foods that you take in, and also helps get rid of the toxins out of the cell as well too. But it's got to be able to be fluid. Okay. In fact, actually, I'm just going to switch images here. And let me explain exactly how. Okay. When you have something too rigid, okay, if you have stuff going back in and out of a membrane, okay, you need to have some kind of flexibility, okay, some flexibility, and that's what the fat does. The fat provides flexibility of your cells, okay. If your cells are rigid, okay, you don't have flexibility. There's very little give. They become more fragile. They become more susceptible to breakage. But also, too, when you have rigid cells, it's because you're allowing the bad fats that make it rigid. When you have too much omega-6s, it makes it rigid. When you have more omega-3s, it makes it fluid, flexible. Okay? Rigid, not good. Flexible, good. Rigid is also full of fats and ingredients that don't allow the nutrients that you want to get in and out of the cell properly. That's what omega-6 does. It's like adding syrup to a sieve. You know when you're sifting flour, right? And you want to get flour and you want to strain it. But imagine adding something that's thick and viscous, like peanut butter, right, to that sieve, right, or sieve. You try to clean it, but you can't. It gets clogged. That's what omega-6 does to your cell wall, your cell membrane. So it can't get stuff in, can't get stuff out. And that's the reason why one of the reasons why it leads to chronic inflammation, because now those cells die. When those cells die because they become starved, then your body's inflammatory response starts to kick into gear, which starts to eat these dead cells over and over again and starts to create a protective response. So it's the first part of that cascade of inflammation. All right, let's go back to the slide. All right. So everybody with me so far? Let's see if there's any questions. Good. I think I have everybody's attention. Great. What's going on? So omega-3s and inflammation. When you have high omega-3s, you lower down you lower down your inflammation rates. Omega-3s helps prevent the silent inflammation. Not to get too technical with the stuff on the right, the EPA and AAA. AAA means for arachidonic acid, which is a bad type of acid, bad type of fat that creates pain that you need for sensing discomfort. It's a part of the process. EPA, eicosapentaenoic acid, once again, very technical term, is what lowers the inflammation, what suppresses the pain signals. But the problem is when you have high omega-6s, you're increasing more of that AA, and you don't have enough omega-3s to counteract that. All right, so the omega-3 is the EPA, omega-6s is the AAA, is the AA. So just remember that AA is bad, EPA is good. Eicosapentaenoic acid. Now, how does fat come to play? If you're carrying fat also carries hormones. Your hormones are also made up as fat as well. It's kind of contradictory here, but let me just clarify this. Your body carries fat. but also too, your cells are made of fat. Hormones are made of fat. You do need fat to create hormones, but you need the right fat to make the hormones effective. If you have chronic inflammation, the very first sign of inflammation, your body responds by counteracting the inflammation. When you have too much sugar, it goes to the fat cells, creates inflammation. Sugar in your fat cells creates inflammation. And when you have inflammation in your fat cells, Sarah, then it's hard to get rid of. Right? The fats, your fats are also trying to absorb toxins as well. Okay, so it's a kind of a vicious cycle. If you have too much of the bad fat, you're storing more fat. You're also not allowing your body to remove toxins. Okay, and when you have too much toxins, you build yourself into a disease state. Once again, cardiovascular health. If you have inflammation on the inside of the arteries, you're narrowing those arteries. That's where cholesterol comes in. So when you're given medication for cholesterol, the cholesterol itself is a response. Your body makes cholesterol in response to damage and inflammation. So if you're giving medication for cholesterol and not being given medication for the inflammation, that's the wrong focus. The cholesterol is just a band-aid, your body's natural band-aid to slow down this, the body's natural band-aid to prevent damage to the cells or the tissues around your blood vessels. You got to figure out what's causing the damage to the tissues and blood vessels. That's often comes to the diet, and that comes from the nutrients that we allow into the body or the toxin that we allow into the body that creates inflammation that causes that damage. Okay, so if you're on cholesterol medication, you're not being treated for the inflammation. You're being treated for the cholesterol. And your body needs cholesterol. Okay, your body naturally creates cholesterol. But if you're creating too much cholesterol, guess what? You have too much inflammation. And your medical doctor needs to tell you that. Or you need to ask your doctor about what you can do to decrease your inflammation. If they cannot tell you, if they cannot give you any instructions or suggestions, find another doctor, plain and simple. Okay? Joint health. So once again, if you have chronic inflammation, it manifests or shows up in your joints as pain and swelling. You go for a run, try to do a long run, and you get stopped halfway, or you find it takes longer time to recover. Or you're not running as fast as you were when you're younger. Or it just ultimately, the sign of inflammation, I believe, is not just tendon to the touch, but how long it takes you to recover between exercise routines, exercise performance. When we're younger, we recover fast. But when we get older, that recovery is much slower. Inflammation just prolongs that recovery. Okay, and more importantly, this is the last more important part, is the brain. Inflammation attacks the cell membranes, the fat around the cell membranes, and you also have brain cells as well, which also uses that exact same lipid membrane, omega-3 membrane. So the brain connections are important and get damaged when you don't have the right fats. Okay, we have too much of the wrong omega-6s or too much of the omega-6s. If you're a mother and you're trying to get healthy for your, throughout the pregnancy, getting enough omega-3s ensures that your baby's nervous system develops as well. That's the reason why pediatric development in utero, like in the uterus and after birth, is crucial. Preferably from mom is ideal. Okay. Secondary, you want to use formula, but primarily the best fats always come from mom. Nothing can be duplicated from mom. Okay. Now there's nothing that man can create that can duplicate the perfect food that comes from mother's milk. Okay. When you have that abnormal fats, you have chronic inflammation that affects the brain. It also changes the mood, also changes your state of mind, anxiety, depression. Okay. As I said before, senility, Alzheimer's, the cognitive disorders are a reflection of long-term inflammation that also affects the brain. So, what do your symptoms reflect about you and your status of health? Looking at this paradigm, looking at this chart, no one's really sitting at one part. No one's sitting at one spot in this diagram. If you look to the right, okay, you're either healing and going towards rebuilding, tissue repair, continuous healing to the right, or you're going towards lack of healing, lack of tissue repair, more symptoms, more signs, more lack of function towards premature death. So the more chronic inflammation that you have, at least you faster towards premature death. Yes, in this country, people are living longer. But the question is, what type of quality of life are you going to have as you age? Okay, are you aging towards physical independence? Are you aging towards being able to work, enjoy life, exercise, do what you need to do? That's where you're heading towards the right. Or are you in a state where you're leading towards dependence, physical dependence, more inflammation, more medications because of inflammation, less mobility, okay, joint pain, arthritis, rheumatoid arthritis. So it goes on where it decreases your quality of life, decreases movement, decreases nourishment to your cells, tissues, nervous system, leads to premature death. So your symptoms tells you where you're going, okay? Not just being symptom-free doesn't necessarily mean that you're healthy. There's an active process. You got to be proactively making changes to your lifestyle, specifically your nutrition. So the omega-3, omega-6 balance is crucial, right? Once we get to the cause, the underlying source of inflammation, then you can start making the changes that makes long-term alterations to how you feel and how you function, okay? So we always go back to what's your omega-3, omega-6 balance, okay? 99 times out of 100, most people have a deficiency of omega-3s. More people nowadays, because of our lifestyle, because of we're not eating from foods in its natural state, we're close to the modern diet, so we're often out of balance of more over-6s, more omega-6s rather than omega-3s. Okay. Now, do drugs work? Yes, they do. They work to decrease pain. But we all know, and everybody who's on this call are trying to live a lifestyle independent of taking medications for the symptom, for that alarm. Because going a few slides back, if you're on the paradigm where you have those symptoms, if you're going to a TCM, or if you're going to a traditional medical doctor, and you're only managing your health when you have symptoms, then you're only living in the place when you're in the red, okay? If you only figure out you have a problem when you have a symptom, then you're actually being managed with the medications and living in the treatment paradigm, which is not getting you close towards a wellness paradigm, okay, which is to the direction to the right. Now, here are the steps you need to take. Okay, essential fatty acids, okay, grains, corns. Now, I highlighted on the list of foods on the left, the omega-6 fatty acid ingredients. In red, you see the corn oil, the peanut, the soy, the canola. Those are important to note because most fast foods, or most food stall foods, or even most fast foods in this country, what makes food cheap is because it's cooked using these ingredients, okay? Cheap food, well, that's the reason why it's cheap. Corn oils, peanut oils, soy oils, and canola oils, unfortunately, as much as they're cheap, they're also more destructive. They creates inflammation. They create a inflammatory response in the tissues, in the blood vessels, that also adds to increased cholesterol. So if you want to control your source of omega-6 fatty acids, simply decrease, eliminate this, right? Start eating at home more. If you look to the list on the right, okay, essential fatty acids comes from cold water fatty fish. So if you love mackerel, this is a fish loving culture. I love it, right? If you love hot pot, go with a fish ball, fish noodle. Go in that direction. I prefer freshwater, free-range fish, or wild-caught fish rather than game or farmed fish. But even farmed fish is better than animal protein. Okay, and the animal fat. So the best animal protein you can consume in your case right now in this country, I believe, is fish. When in default to fish. That's a first choice for omega-3 fatty acids. And then second and lower on that list are the meats, right? Specifically red meats if they're grass-fed. Most people, I do believe, are not buying grass-fed meats. If you're not one of these people, up your fish intake, and that's what can increase omega-3 fatty acids. Okay, more fish, sardines. You get it, ota, right? Without the corn, or without the other ingredients with it. So, more fish sources. Flax, hemp, walnuts, those are nuts. Flaxseed oil, hemp oil, walnut oil, you can get omega-3s through that. They sell it in cold storage. They sell it at any grocery store in Singapore. It's something you want to add to your salads. It's something you want to add and not heat up too much. And if you're often not getting enough of this in your diet, if you're not eating enough fish, you're not getting some of these meats, almost everybody needs to supplement because we're often deficient in the omega-3s that we need. So I always recommend supplementing in this. Okay, guys, we're doing great on time. Now, I don't believe that anybody should adapt this belief. There's nothing can be done. Yes, there is. You're learning the facts of what you can do to come off medications, the change they could do to take, because your doctor's not going to say, hey, we want you to take less medication. You have to make that effort. You got to make that step. You got to ask the right questions. Doctor, what can I do to decrease my dosage or to come off these cholesterol medications? And there is unsurmountable evidence that shows that if you make these changes to the diet, make these additions of these omega-3 fats, make these eliminations of these omega-6 sources of fats, it will make a significant change and difference into how your cells and tissues are either healing or becoming inflamed. So if you want them to heal, make those changes. Okay. Now, what can you do to fix? Wow. Here's the $100,000 question. Reducing fast white carbs, meaning that fast meaning like the carbs that you digest very quickly, that pass through your digestive system very quickly. Breads, grains, rice. I know this is the big one. I'm in Asia. Rice is a staple. Okay. If I'm going to say to eliminate all rice, let's be unrealistic. I mean, that'd be an unrealistic expectation. But do whatever you can to minimize it, decrease it, half your portions. Okay. Start adding brown rice, colored rice, cargo rice, the Thai heavy grain rices, the white polished rices, this basmati, the jasmine rices, the sticky rices. Those are the ones that actually also increase inflammation. Okay, cereals. So any of the grains that you find in packages on the shelves is what helps add inflammation. And I said before, the omega-6 vegetable oil sources that you find from fast food or packaged foods, that's where you're going to have the source as well. But add in more meats, grass-fed meats, add in more fish. Okay, I want to highlight the part fish, and eggs. All right, preferably cage-free or free range. I know they're expensive, but think of it as an investment. Okay, now free range versus free range eggs versus farm versus caged eggs. Cage-raised eggs is a difference of fats, because caged chickens are fed grains. Free-range chickens are feeding off the grass, feeding off the good types of fats that they find in nature, from the grass, from the greens. Okay, so the source of the grains that we feed these animals also go into our bodies as well. So cheap eggs also increase the omega-6 content in our body. So be careful with the type of eggs that you choose. Okay. Now, colorful fruits and vegetables. Once again, these are anti-inflammatory ingredients, right? If you have more color on your plate every day, either for breakfast or for lunch or for dinner, great. Add more color, add more greens, add more reds. Okay. If you have greens and reds on your plate, you're doing great. Keep it up. You're adding anti-inflammatory ingredients. My only concern is that how it is cooked. Steamboat, love it. And here's what I got to stress. So we all love good tasting food. However, don't confuse quality with quantity. Okay, quality is less. Quality is less cooked. You can get cheap food quantity. Like, people love to feel filled up. People want to get their money's worth. Okay. However, be careful about the quantity of the type of food that you're taking in. Okay. Do we all like to cheat? Yes. Okay. Do we all like to have cheap food sometimes? The street meat food sometimes? Yes. It's enjoyable. But the frequency of what we enjoy it and the quantity of what we consume of it makes a difference. Minimize that. Because once again, when you're eating out, fast food, or even dining restaurants as well, unless it's fine dining or food to table type of meals, or using organic ingredients, chances are these ingredients also are cooked with oils that actually create the inflammation. Okay, high heat wok cooking, that type of frying, that's the type of oil, including sesame oil too. Okay, those are the type of oils that creates inflammation inside your body. Okay, and once again, Asian food, this part of the world, the flavor comes out in the oil, and that's where the struggle is. So you got to be able to manage and decrease your dependence on these types of food stands or food stalls or this type of cooking, and try to create yours from, try to create from home, right? And cook from home as much as possible. Because at home, you can control what you put into ingredients. Start substituting avocado oil, olive oil for the vegetable oils. Okay, avocado oil, olive oil, better. I'm a fan of coconut oil. All right, that is a good fat. That helps decrease inflammation. Okay, coconut oil, go to town on it. Okay, can't get enough of that, and you can get it any place in Singapore, any grocery store. And once again, supplementing is key. Okay, most people are deficient. So, are you eating the right foods? Are you moving more? What are your thoughts? So this, in a nutshell, is, let's see, no more questions. Okay, I think we're moving on quite well. Yeah, plain and simple. Decreasing inflammation depends on how you move, what you eat, and really believing that your body is able to heal naturally without medications. Okay. Now, if you get to the point where you have so much inflammation you can't turn back the clock, well, every so often you do need some drugs, but we want to give you the tools to ensure that you don't have to reach that point. Okay. So starting today, taking this information is your reset button. What are you going to do to start doing differently today so that it can make a difference in how you feel, how you run, how you sleep, how you recover, how you're able to get one or two extra bowel movements a day, more so than we have right now. Okay, so this knowledge that you learned today is all about resetting the steps, what you can take to decrease or reverse the inflammation that you have right now. Okay, so we're talking about this as chiropractors because we talk about stress on your nervous system. Stress comes from our mindset. Stress comes from our thoughts, in terms of what we think. Stress also comes from our traumas in terms of damage that impacts the spines. But also stress comes from the toxins. One of the most common toxins that creates interference within brain-body connection comes through our diet, comes from medications, comes from ingredients that we allow into our bodies that creates inflammation. Okay, and inflammation in the spine and inflammation of the nerves around the spine also creates that disconnection, that brain-body disconnection that we call vertebral subluxation. Okay? It causes your joints to lock up, causes your spine to lock up. It stops moving properly, creates misalignments here, and that creates that vicious cascade of nerve system interference that leads people to our clinics or leads people to a more greater stress state that creates more medical intervention or more further disease or further dysfunction. We don't want that for you. This is the information that you need to learn so that you can change your life. So no one has their head in the sand right now. Everybody's taking the steps to become more informed by being here on this webinar right now. But if you have any question about what you have today, what you learned today, please let me know. Now, just before we go here, yeah, this is a very straight talk, and it's kind of hard to articulate the images of inflammation just by talking with my hands in this visual interaction. So normally I don't do a lot of these slides, but hopefully I didn't go through these slides too fast. Hopefully they weren't too wordy. So I'm just going to hang out for a minute or two to see if there's anybody who's online right now who's got some questions. And I'm going to try to answer any questions that you might have to whoever's listening. Do we have any questions? No? No questions. Are in the box right now? No questions. Oh, okay. So Daniel is asking. Hey, Daniel, thanks for asking the question. Okay. Pig oil. Gosh. Here's the thing about pig fat, okay? The fat for the pig is designed to absorb toxins. Okay, understand this. Pig fat is the worst fat you can buy, you can take in. Think of a pig. If a poisonous snake bites a dog or any other animal, that poison will kill that animal. When a poisonous snake bites a pig, the poison will not kill the pig because the fat absorbs the toxins from the poison. So whatever it is that enters the pig, whatever that the pig consumes or whatever it eats, it absorbs into the fat. Good food, bad food, like pigs eat anything and everything, right? So that's the reason why now when you're slicing a pig and eating bacon, eating the fat, you're also absorbing the toxins that come from that pig. Okay, so there's a higher toxin ratio, a higher toxin amount in pigs versus other animals, okay, because of the fat. So yeah, that you do not want to. That is not a good fat at all. Okay, not a good fat at all. All right. If you're doing wild boar, that's a healthy pig. All right, that's a wild caught. That's a wild game pig. That is a good fat. Okay, wild boar. And if you're hunting, good for you. Right. Good luck in Singapore or Palo Island, right, or whatever that island is. Oh, another question is oatmeal. Certain oatmeals are good. Oatmeal has some good fats, but oatmeal still high in the omega-6s. It's got not much omega-3s, but more omega-6s. So oatmeal is good because it has a lot more fiber, more filling. Okay, it has more fiber. Fiber helps to slow the digestive system down. Fiber also helps create more bulk. Fiber also helps you create more, helps toxins pass through your system faster. That's a job of fiber, and that's where oatmeal comes into play. But oatmeal is also still a source of sugar. It does not create as much inflammation as other grains such as rice or sweets or refined carbohydrates. Okay, it's a better grain, but it's not the grain I choose for decreasing inflammation. Does that make sense? Okay, so it's a great grain for feeling full, eating less, lowering, and it lowers down your cholesterol because you don't eat as much other stuff when you're eating oatmeal. Okay, all right. Hopefully, I answered that question. So oatmeal, small quantities, a couple of times a week, is okay. It's healthy. It's healthier. Okay. Now, Sarah's asking, omega-3 foods should we eat to try to eat every day? Every meal, well, ideally every meal. Okay. If you think back to your grandparents' generation, fish was abundant, fish was readily available, fish was cheap. They lived longer, right? Asians live longer. This part of the world has known to live longer because of the diet and the parts of traditional lifestyle. And I used Okinawa, Japan. Those are centenarians. Those are people that lived 100 years of age and older. Like their lifestyle is fish based. Okay, so the more fish they eat, the better. Omega-3s, in terms of how much, I personally like to supplement with at least 3,000 milligrams or 3 grams of omega-3 fish oils, okay, or omega-3, omega-6 ratio combo. I like to just go straight to omega-3 personally. I'm a fan of krill oil myself, so I take as much as 3,000 milligrams of that daily, okay. That's a supplement, but you can't overdo your source of omega-3 foods, the walnuts, oils, the fishes. In fact, you're going to feel more full. You're going to have better skin. It's going to change your hair texture. It's going to improve vision. Actually, omega-3s also has been tied to attention, ADHD in kids, ADD, ADHD. Those who have low omega-3s often have high rates of attention deficit disorders. So the kids with those problems have deficiencies of omega-3s. That's a connection. Depression as well, too. Okay. All right. Daphne's asking, hey, Daphne, love the name. Saturated Ichi oil. I don't know what saturated Ichi oil is, Daphne. I've never heard of it, but I'm now interested in checking it out and learning more about it. So I can't really comment on saturated Ichi oil. Sorry about that. But I will do some homework on that and hopefully answer you in person. Okay, Daniel. Daniel is asking, is olive oil good for light pan frying food? Yes. Key thing is cooking with olive oil, don't let it smoke. You don't want to cook high heat. When it smokes, it denatures. When it denatures, starts to turn brown, then becomes acidic, then becomes inflammatory. So when you cook olive oil in low heat or medium to low, it's good. You don't need a lot. You just need to toss it. You don't need to like deep fry an olive oil, right? But the fact is that if it's smoking, it's too hot. So when you cook with olive oil, you got to cook it on a medium or lower heat. Okay. All right, Daniel. Hope that asks. I hope that answers the question. Okay, and Daniel is also asking, my wife is going on a morning diet of assorted nuts like almonds, walnuts, hazelnuts. Yes, good fats, great snacks. And she's trying to get me to join her. You mentioned about peanut and vegetable oils, omega-6s. Peanuts of all the oils, peanuts is first of all, peanut is not a vegetable. I mean, peanut is not a nut, it's a vegetable. But peanut oil is an inflammatory food. Okay, so if you have chronic inflammation, if you have joint pain, peanuts will exacerbate pain. All the other nuts, right? All the other walnuts, almonds, macadamia nuts, all the other nuts don't create inflammation, but peanuts do create inflammation. Peanut oil creates inflammation. So if you're dealing with chronic inflammation, joint pain, or indigestion, or eczema, I'm going to pull out the peanut oil. Okay. One more question. I see Poon Hui. Okay. A good source of carbs. Great source of carbs comes from food as a natural state, vegetables, the greens. Okay. If it's not processed in a package, it's a good carb. Okay. If it's not ramen, I'm sorry, ramen is tasty, but it's a horrible carb. Okay. The packaged $3, the 30-cent ramen packets you get from the dollar store, those are horrific. They don't even digest into your body. Actually, they take so long to break down. Okay, and that creates inflammation, because now when it takes a long time to break down, your body starts to go into this, your digestive system starts to create more of an inflammatory state inside your digestive tract, and that inflammation of your digestive tract slows down digestion, and also when you have slower digestion, you also put yourself in a precancerous state, okay, colorectal cancer. All right, great question so far. If there's no more questions, and I'm seeing all the questions on the side. Thank you, Vanessa, for pitching them to me. All right. Oh, whole grain bread. Okay, Jackie. Whole grain bread, peanut butter. That's inflammatory. Okay. Better butters or better nut things to use would be almond would be better, or tahini would be better, sesame seed butter, but peanut butter is inflammatory. Now, here's the thing. If you're a fan of peanut butter and you cannot get away from peanut butter, I love peanut butter, I deviate to the natural peanut butter, meaning that if you look on the side of the ingredients and it says peanuts, oil, or peanuts and salt, that's it. If you look to the processed peanut butter, the one that's extremely smooth and creamy, it stays creamy at room temperature because of the polyunsaturated fats, the bad fats that create inflammation. The good peanut butter gets chunky. It's harder to turn, harder to mix. The good peanut butter actually separates, gets the oil on top and gets thick on the bottom. That's a good peanut butter. If you're going to use peanut butter at all, choose that one. All right. Does that help? Great. That's a good question about the peanut butter. I love peanut butter. All right. And whole grain bread. I'm not a fan of bread. I try to avoid it as much as possible because, once again, grain or too much grain, too much is a carb source, and carbs create inflammation as well. Okay. Yeah. So is whole grain better bread? Yes, it is. But once again, it's whole grain still can create a glycemic index. It still can create an insulin response. So any foods, white bread, even brown bread, that create that inflammatory response or that insulin response, because it's still a sugar. And sugar in your bloodstream, what's what creates inflammation. So unfortunately, whole grain bread, even though it's got more fiber, it's got a lot more sugar in it. So try to get in the habit of deviating away from breads in general. Okay. There's so much tasty food in your country, in this place here. There's so many other things to eat other than bread. Why do you want to go back to your Western-based food? Yes, it tastes good, but you know what? It's got nothing to do to heal. I mean, it's tasty, but it creates more damage in the long run. Okay, so try to deviate from whole grain bread or breads in general. Sesame oil. Sesame oil is great for taste, but I wouldn't want to fry with it too much, because once again, that's oil that when you cook it traditionally at high heat, and it smokes. And when it smokes, it denatures, and that's what becomes inflammatory. So sesame oil is one of the foods that you don't want to cook too much with, because it is an inflammatory oil. Okay, use very, very sparingly. The smoky flavor of it, great, but once again, minimize it. I think that's all the questions that we have. Now, if you guys had fun, or if you guys got a lot of information, give me a thumbs up in the chat box here. This wasn't as painful as I thought it'd be here, but it does feel like I'm talking to you in real time, real person. And hopefully I didn't talk too fast. And if you have any other questions or concerns about your own unique condition for yourself or a family member, hey, you can see me in the clinic, or you can talk to any one of our doctors who are well-versed and well-knowledge on this topic with you as well in your clinic. However, even if you're a guest of one of our members of Total Health Chiropractic, you're invited to connect with us or even have a consultation with any one of our clinics at all. And please, if you're a guest, you can just go on and you can scan our QR code to schedule your own consultation. There's no obligation here, but more importantly, just want to make sure you get the same benefit as our patients of knowledge, information, and help the spine and nervous system. So here's going to leave at, I'm going to leave this right here. So once again, thanks you for your time. This is our gift to you guys. If you're in line watching this right now, and if you're not a client of us, go ahead, scan or give this opportunity to somebody else that you do know. So this is our gift for your time, for your attention. Okay. I want to apologize for the delayed start. I do appreciate everybody who's on, who was patient, and I have fun doing this. I had fun preparing for this as well too. But more importantly, I know in fact that those who are on board, who are watching and listening to this, are going to take their health journey to the next level. They're going to put it in overdrive and take that information for themselves and share it with their families, their loved ones, and those that they care about. Okay, because many people need to hear this. How many people do you know in Singapore that you do know that in your social circle, if they heard this, it'll change their life. It'll make them complain less. It'll help them get out of the bed easier. It'll change how they look, their skin, their whatever it is that you know that they are suffering from. If you know that they're suffering or might be suffering from inflammation, let's talk. Get them to talk with us. So we want to reach out to this community, and the way that we do this through workshops like this, through you guys. So we want to empower you guys to transform our community, this community. Singapore is my community right now. Love you guys. I appreciate your time and attention. Thank you much for the Total Health Chiropractic team, Vanessa and Tim. But more importantly here, thank you for those who are attending this webinar. Any questions, just shoot us an email or follow up with your individual doctor. My name is Dr. Maxwell, and looking forward to the next webinar that we have in a couple of weeks. Stay in line, stay posted, and let's have fun. Take care. God bless.